So I know your child started treatments with the allergy drops about 5 months ago now.
Yeah.
What's
Mhm.
the biggest change you have noticed since he started?
His skin, his skin. He had a lot of eczema. I don't think I ever mentioned that earlier. He had eczema and very dry skin. We noticed that now his skin is so supple. I kind of make fun of him because he'll come down all rosy and cheeky.
Allergy treatment with immunotherapy is so effective and it really changes the quality of life of a person. So when I found another solution, I was very, very happy to share it with my patients. And that's what I want to share with you today. And it's called allergy drops. The beauty of allergy drops is you can administer it yourself, usually 2 to 3 times a day. And most people just put it under, put it next to their toothbrush or on their nightstand, and they just use it, right after brushing their teeth. So it's so convenient. So today I'm going to have you hear it from somebody else. So thank you so much, Dr. Dupe Adeyefa, for agreeing to share your child's experience with us. So,
Mhm.
Doc, can you please tell us what symptoms your child had and how long they had had symptoms when you decided to do allergy testing?
So I think for our son, we just noticed that he would go to school, he'll come back with a lot of rashes. And maybe if he got bitten by a mosquito or something, he just has some skin changes that would kind of swell up and then it would burst open and it would ulcerate sometimes.
Mhm.
And we knew that there was something going on because his grandmother had allergies, his dad had allergies. And so I didn't have any allergies growing up. So I knew it wasn't, if it's genetically, it wasn't going to be coming from me. So I had to learn about my husband's side. And so I know that his dad has allergies to certain things. And so I figured that maybe perhaps David is kind of following along the same pathway. And so we wanted to make sure that, we could at least test early, whatever it is, we could at least help him so that he doesn't have to struggle. Because he couldn't be outdoors for too long. He'd just come back home scratching his skin and he would just develop with these weird rashes. So we just wanted to make sure that there wasn't something we're missing. So we, pursued the whole allergy testing with you.
Okay, great. So you answered my next question about why you decided to. So I know your child started treatments with the allergy drops about 5 months ago now.
Yeah.
What's the biggest change you have noticed since he started?
His skin, his skin. He had a lot of eczema. I don't think I ever mentioned that earlier. He had eczema and very dry skin. We noticed that now his skin is so supple. I kind of make fun of him because he'll come down all rosy and cheeky. Like, wow, David, you look really nice. So his skin was the first to change. And he loves playing outside with his boys in school. And so
Mm.
he hardly ever had any problems. He didn't have swollen eyes. His eyes weren't as itchy anymore. And now he plays basketball in his basketball goal court, whatever basket they have outside. Now he actually goes out to play more. So I've seen that he's definitely more outdoorsy and kind of feels a little more comfortable going out there. And we haven't noticed those rashes, and he hasn't complained of the itchiness too as well.
Okay, that's amazing. So that's great because, it really changes the quality of life of the person. And that's the
Absolutely.
that's
Yes.
the thing that, I wanted to mention. So I'd mentioned earlier in other episodes that there are many ways to treat allergies. There are over-the-counter medications, and then there are more permanent solutions like the allergy drops and allergy shots. So allergy shots are pretty effective as well, but we used allergy drops in your case. What
Mhm.
what has been your child's experience with the drops? Like, why did you choose the drops instead of the shots?
I don't know. I think the shots we had to come to you in person or come to somebody to get it done. And given my schedule um, and his rigorous school work and other stuff he's doing, it just made more sense to do the drops. And for my son, he's very organized. So I didn't think he would have a problem with that. He's the kind of guy that you tell him to do something, he will take out his clothes and make sure everything is aligned. So I trusted that if I told him, you take 2 drops in the morning or 1 drop in the evening, he would do it. So I think because of his personality, I kind of felt comfortable going along with the drops. And secondly, he's deathly scared of shots, so that would have not worked.
That one,
That would probably may have been a little bit harder to push. I
right.
hope to see this video one day, but yeah, he doesn't like shots, so I kind of figured the drops were the best option for him, and he's done an incredible job with like keeping up with it. Every other day I will ask him, "Taking your drops?" And like, "Yep, I do 2 in the morning, 2 in the evening, or something like that." And he does it. He really sticks with it. And I think because he's seeing the changes, it's also
Mm.
made him to continue.
Yeah, and I am really impressed with him. Like he's been a stellar patient. Like I feel like he knows more about it than you do, actually.
I don't, let me be honest. The day I got the drops, I told him how to do it. I have not I mean, I have not really kept up with him.
Right,
He has other siblings. There's a lot of them. I have 4. So juggling all 4 with a busy life, career, and everything else,
right.
it's good to have a son who knows what to do. And I check his bottles once in a while, and I see that it's definitely decreasing. I just trust him to do the right thing, especially with the drops, and he has been doing a good job. We haven't seen any side effects so far. He's doing well, and he's been able to play and not have any. I mean, his skin is literally the biggest change that we've noticed. His skin is he's no longer he had eczema. Like I said already, like we don't see any of that right now. So yeah, he's been doing good.
Yeah, that's great. So you've heard it here. There are options for allergy treatments. So if you started allergy shots, for example, you did follow through, consider allergy drops. Or if you have allergies or you have, trouble just with itchy eyes, runny nose, congestion all the time, you're not comfortable outside, and you want to be more comfortable, you want to have a better quality of life, there are options. So you can learn more about allergy drops on episode 38. And if you're anywhere in Texas and you have allergies, asthma, eczema, and you want to get tested or treated for these things, you can learn more. The next step is pretty straightforward. If this has helped you, help someone else, share this video, and then contact us for testing and treatment. You can call us, you can text us. The information is in the caption. So thank you so much, Dr. Adeyefa. This has been so helpful. Thank you for sharing your experience with others so that you can help them. Did you have anything else you wanted to add?
No, thank you so much for the opportunity to speak about this, and we are truly believers in this process. I have another child that might need one in the future, and I'm looking forward to getting started with them too as well.
Awesome. All right, allergies are worth addressing. I hope this has helped you. We'll be back next week to discuss more about allergy treatment options. Thank you.
Thank you.